Maybe talking about the overview of the ethical dilemma of opioid usage and Narcan administration with advanced directives. This ethical dilemma focuses on opioid overdose situations where Narcan can reverse respiratory distress and potentially save a life. This conflict occurs when a patient has an advance directive, such as a do not resuscitate order, that may limit life saving interventions. Nurses must decide. Pros of administering Narcan. It aligns with the ethical principles of beneficence and non maleficence by preventing harm and preserving a life. Many overdoses are unintentional, and Narcan provides a chance for the patient to survive. Because Narcan is temporary and reversible, it can be viewed as an emergency intervention rather than long time life support. The cons of administering Narcan. The major concern is violating patient autonomy if the individual clearly stated that they do not want life saving interventions. Narcan can also cause immediate withdrawal, which is distressing and painful. And for patients who are addicted, they don't always want to go through withdrawal. They want to keep doing drugs, so they might not like it. And nurses may face legal consequences if Narcan administration goes against documented patient wishes.
Hello, I'm Isabella Frosto, and I'm going to be talking about our group's stance when it comes to opioid use. Our group does support the clinically appropriate use of opioids when they are prescribed for legitimate medical purposes, such as acute pain, cancer related pain, or palliative care. Opioids remain an important treatment option when used responsibly, with proper assessment, monitoring, and patient education. The goal is to balance effective pain management while minimizing the risk of misuse, dependence, and adverse outcomes. At the same time, we strongly support unrestricted administration of Narcan or naloxone during suspected opioid overdose situations, particularly when the patient is in acute, life-threatening respiratory distress. Naloxone is a safe, evidence-based medication that can rapidly reverse opioid effects and restore breathing. In emergency situations, patients are often unable to provide informed consent, making immediate intervention ethically justified. To add on what I previously just mentioned about our group's stance when it comes to opioid use, opioids remain medically justified when the benefits outweigh the risks of untreated pain or suffering. This requires a lot of clinical judgment and professional expertise to determine when opioid use is appropriate and when alternative therapies may be safer. Administering Narcan during overdose aligns with the ethical principles of beneficence and non-maleficence, as it prioritizes saving the patient's life and preventing harm. Together, federal guidance, nursing judgment, and ethical responsibility support this timely intervention while ensuring care-based decisions that remain client-centered and evidence-based. Federal guidance from the Substance Abuse and Mental Health Service Administration reinforced this use of Narcan during opioid overdose events as a standard life-saving intervention. SAMHSA also supports the use of a national helpline to assist healthcare providers, patients, and families with overdose response, education, and connection to the treatment resources, emphasizing that overdose extends beyond immediate emergency.
Hi, my name is Annalise. I'm also going to be talking about our stance and some specific points to support the ethical rationale behind it. So, we are in support of clinically appropriate opioid use, and this is because it prevents undertreatment of pain, which is an ethical issue and a patient's rights concern. Also, opioids are one of the most effective treatments for acute pain caused by trauma, surgery, or cancer. And finally, it supports autonomy by respecting a patient's need for adequate pain relief. And then our second point in our stance is that there should be unrestricted Narcan administration during suspected opioid overdose, especially if the situation involves acute, life-threatening respiratory depression. So, to support that, we found that life-saving benefits of naloxone in the event of an overdose show beneficence by reversing respiratory depression and non-maleficence by not risking preventable death. Also, we can allow the use of Narcan, and this shows non-judgmental care because it reduces stigma towards those who suffer from opioid use disorder. And then it also ensures equitable treatment for a vulnerable and high-risk population during emergency situations. And finally, brain injury or death can occur within minutes without an intervention such as Narcan. So, allowing unrestricted use of Narcan all around, it saves lives and it protects our patients.
Hello, my name is Cameron, and today I'm going to be diving into the ethical decision making in opioid overdose. As stated before, opioid overdose is a major public health crisis, and nurses play a critical role in preventing death through Narcan, also known as naloxone. Research shows that naloxone is distributed specifically to prevent serious harm and death from opioid overdose. Studies also support how naloxone can be safely administered and contributes to decrease overdose deaths at the community level. From an ethical standpoint, harm reduction aligns with biomedical ethical principles: autonomy, beneficence, non-maleficence, and justice. Harm reduction supports patient autonomy while preventing harm, improving patient well-being, and promoting equitable access to life-saving treatment. The ANA Code of Ethics requires nurses to advocate for patient safety and protect life. The Nurse Practice Act requires nurses to provide evidence-based emergency care, and the Patient Bill of Rights supports access to emergency treatment. Because opioid overdose is often reversible, administering Narcan supports both ethical and legal nursing responsibilities. Thank you.